Salam, everyone. This is Dr. Al Hassan. And as promised, I will try and keep these very, very short. So I want to speak to you about, the patient encounter. And the very first thing that I want to speak about is being a human being before being a physician. We're all human. However, you are more educated than your patient. And so you are the physician, they are the patient. However, you must remember that we're all human. So I want you to be human. Be kind to your patients. These patients come to you because they are, in pain, emotionally or organically. They are in need for your services, for your education. They are in need for you. Sometimes they're in a crisis. It's an emergent situation. They are actively dying. And so, what I want you to do when you see your patients is to remember that they're human beings and they are in need for you. So, I want you to be very kind to your patients. I want you to please try and sit down if you are able. If there is a chair in the room, please try and sit down. The studies have shown that when the physician sits down with their patient, the patient feels more comfortable. They feel like they're being listened to, and they also feel like the patient gave them more time, even if you didn't. They just feel that way, and they just feel more appreciated and more welcomed. And it doesn't cost you anything. You just need to sit down. You don't need paper, you don't need a pen. All you have to do is just sit down and listen. And when you listen, try not to interrupt your patient. Again, studies have shown that most patients can only talk for about a minute about what brought them to your office or to the emergency room or whatever. So 1 minute is not bad. Let them have that minute. Let them talk. And try and be understanding. Try and, understand where they're coming from. Try and be uh, sympathetic or empathetic or whatever the word may be, but try to understand where your patient is coming from. So once you've already sat down and you're made that eye contact and the patient is feeling comfortable and they're speaking to you, then you can be that detective. You need basically from all the information that the patient is giving you, you need to decide about which information is useful versus which information is useless, and you need to arrive at a diagnosis, right? This is the most important part of the patient encounter. This is what we try and get to. The diagnosis is the most important thing. When it comes to treatment, like I don't want you to jump to a diagnosis and then jump to a treatment, because treatments are very, very easy once you arrive at the correct diagnosis. Even if you don't know treatment, you can always look it up. You can just Google treatment for COPD, for example, and it'll give it to you. But you need to get here, and you get here by doing very good detective skills and by asking the right questions. But we will get to how to arrive at the diagnosis 99% of the time. For right now, I want you to remember whenever you see a patient, I want you to get here. This will make you the best doctor that you can possibly be, because as doctors, we tend to only focus on the one aspect of the human being, which is the organic part, which is the body. Most of us are trained and are excellent at figuring out what's wrong with the body and trying to treat it. But this is not the complete human being. Humans are comprised of their body, their emotions, and their social status. And I want you to think about all three things when you see a patient. So you're going to talk about their body because you're a doctor. This is what you do. Basically, patient diagnosis. This you will know this 100% of the time. But I want you to also consider the patient's emotional status. If the patient is in the room crying, I don't want you to ask them what allergies they're having or why their foot is hurting or why they're in the room. Sit down, think about their emotions, what they must be going through. Try and understand, and be caring and compassionate. And so I want you to also treat the emotional aspect. Think about their feelings, why they're anxious. Think about all this stuff. And then I want you to think about their social status. I don't mean like they're middle class versus high class. I mean, where are they living? Why are they doing drugs? Why are they doing alcohol? Why are they depressed? Why? All these things. And so I want you, when you figure out what's wrong with them and you want to treat, you have to treat all aspects of your patient. You have to treat this, you have to treat this, and you have to treat this. And in this way, you have completely changed your patient's life in the time that they saw you. And so I guess I don't want to make the video any longer than it has to be, but for the very first video that we make together, I want you to think about these things and remember to always address the entire human being rather than just the organic stuff.